speaking of vegetables, there is a mushroom. Is a mushroom a vegetable?
No.
I was trying to think of a segue there. Okay. What is a mushroom?
In the kitchen, sure. Call it what you want in the kitchen, but no, technically it has nothing to do with.
What the heck? It's a fungus. Who wants to be like, speaking of fungus?
I know.
Hey, Tina.
Hey, Leah. How's it going today?
It's going pretty well. We've got a really interesting subject that we're going to talk about. We're going to talk today about chemo brain, which isn't just for chemo. It's actually known as cancer-related cognitive impairment.
Or commonly known as brain fog.
Brain fog, chemo fog, brain farts. I think chemo farts is a completely different thing. But it could be chemo brain farts. But yeah, it's one of those symptoms. And I think a lot of people do experience it during chemotherapy. And then once it's done, you kind of expect it to kind of clear. And for many people, it does not. And it's completely distressing. And I think it's a really important subject. I think it's really important also because for a really long time, it wasn't acknowledged.
Yeah, like so many things that are without a criteria for so long. If there's no criteria and it's not written down, in black and white, then its actual existence is questioned by the establishment. I think we've come a long way, but yeah, certainly 20 years ago, this was not as commonly talked about or recognized.
Right. I think it was dismissed as, oh, you need to get more sleep. Oh, you're depressed, that kind of thing. And what's really cool is I sat in on a webinar yesterday. It was with the University of Texas at Austin.
Mm-hmm.
The presenter was Dr. Ashley Hennigan. She is a nurse and a PhD, and this is kind of her focus. She said she's not a cancer survivor. This is just her area of interest. So I sat in on the webinar, and it was so cool because it validated everything that I feel like I've been doing. And I learned more, which is
cool.
Like the whole point of like sitting in on a webinar. You want to learn stuff, but the validation of all of the things that I kind of compiled,
mm-hmm.
Over the years, because I guess my interest in chemo brain started in about 2013
mm-hmm.
when I started working at the Cancer Center in Arizona. And I'm going to tell a story.
All right, let's do it.
Okay.
I want to hear it.
Once upon a time, I worked at a cancer center in Arizona. For those of you who have never joined in and heard me say that before, I was relatively new and spoke with the speech and language pathologist one day. And she said, are you aware of the services that we do here? And I was not. And so I sat in with her. Like I made an appointment with her
mm-hmm.
and went through her evaluation of patients. And so I did the MOCA test, which is a cognitive screening test, like to check people for cognitive impairment or Alzheimer's. And then she guided me through different things that she would do, to help patients.
Mm-hmm.
And one of the things was there are apps available. And so it's cool because it's more than crosswords, it's more than Sudoku.
So this was this, I never know. I always say it differently than it's spelled. So I think I
just did
Sudoku, but I don't think it's proper. So this is a speech therapist that does the cognitive assessment.
Yes, a speech and language therapist, and occupational therapy did it as well. So for people who are at a facility where they have occupational therapy, they most likely are familiar with this sort of assessment.
And so you got this assessment done just to find out what it was about?
Just to find out what it was about. And so that if I recognized that a patient needed to be evaluated, then I could refer them on. And it's interesting because I believe I did this in September of 2013.
Mm-hmm.
And that would have been pretty much a year before my diagnosis.
Okay. So you had a baseline assessment. That's something most people don't get.
I know, I did. I had a baseline assessment. And it's funny because at the time I thought like, oh, I'm really forgetful, and I think it was just probably stress related coming off a residency and all of that sort of thing. But yeah, I remember the test was normal, which is like one of those things where you're like, really? Can we do this again? Because I don't think it is normal, but it was normal. And I did the apps. I just played on the apps because it's just kind of like you're sitting in an airport, you got an app. Why not?
Now, let me ask you this. Did you get retested at any point post-treatment?
I don't remember. I don't think I did. I think, no, after treatment and then after my surgery, especially after surgery, my big concern was I lost my voice from the surgery. And so I saw her for speech.
Okay.
And I think that the memory thing, it wasn't as big of a concern then. And honestly, I think it's because I was working. I never really stopped working except for the time when I was recovering from surgery. And so I think just using my brain, like I knew what I needed to know at work. I mean, at home, I was different. But at work, I think I was still sharp. And so,
so now this is interesting. So you're saying you worked through the treatment, took the time off you had to for physical recovery, but mentally you were capable of continuing. And I know what we do. So I know it's rigorous mentally, and you were able to do that, but then you'd go home and crash.
Yeah. Yeah, all the word finding and all of that sort of thing. So let's kind of talk about, like, it's not just like memory. Like we think about chemo brains, memory issues, whether it's long or short-term memory. There are more layers to this. It's the ability to multitask, these like paying attention to things, especially breast cancer patients. I hear a lot of them talking about, like, do you find that you have ADHD after treatment? So yeah, there are definitely more levels. Yeah. The word finding, the verbal fluency, which, I struggle with sometimes, just trying to find that right word, how fast you process things.
Yes.
So yeah, it's kind of like, it's more than memory. And so I think when people think like, well, maybe, I've got this memory issue, but I seem a lot less organized.
Yeah. Yeah. It's interesting that you say that, because I think from what I've read, for the perception of this fogginess post-treatment, most people do not bring it up too much during treatment because, you're dealing with other things during treatment and maybe
you're just trying to get through treatment.
Yeah, exactly. And afterwards, people are able to even perform on the gross testing decently, like the kind of gross cognitive function testing that looks at whether you are going to have a quality of life that's so impaired that your activities of daily living, as they call them, you're not capable of doing. And most people, that's not the issue. They can still get up and take care of themselves, but everything's a little different. Fog is a good word. Don't you think that kind of reflects it?
Yeah. And I mean, fog is that sluggishness, that slowness that I always think about, I don't know if you've ever had one of these dreams where like you're stuck in mud and you're trying to run. No, you've never had one of these dreams. Wow.
No.
Well, there are these dreams that some people can have. Have you ever been in the deep South when it's really humid?
Yes. Now that I have experienced.
So,
yes.
You feel like you could just move that like humidity aside with that slowness that comes over you. Yeah, that's kind of, I guess you would say, the brain fog thing.
And just technically, that's all executive function. Like if this were a pyramid, that's the tippy top of the pyramid of cognitive function, is like being able to, well, we call it multitasking, but being able to even filter out distractions while you're doing one thing, or, keeping your calendar, hearing your kid, making your grocery list, and kind of doing this all at the same time is executive function. And I think that's what is the highest functioning of our brain, actually. And so it is a lot of times, I think. Yeah, that's the last thing to come back as the brain heals from treatment.
Yeah. So I think that people have established that, yes, this is real, this chemo brain, as it's called. And it's not just, chemo brain is not just for chemo, right? It's not just for chemo anymore. It can be caused by a variety of treatments and other conditions, right?
Yeah. So, of course, as we have said before on this podcast, one of the risk factors for cancer is aging. And so there is more cancer treatments, and cancer survivors with an aging population. So aging is also a risk factor for cognitive difficulties and cognitive impairment. So there's two parallel tracks here. We're talking about the treatment, but we're talking about a person, and with every passing year and decade of life, generally speaking, the brain ages. And interestingly, some of the changes that happen during chemotherapy specifically mimic an aging brain. So in some ways, you're kind of fast forwarding the aging process. And I'm talking about structurally, like on imaging and actual tests that look at the anatomy of the brain. That's not to say it can't be reversed. You can still do something. So I don't want to be a total Debbie Downer here.
No, because that's my job. But yeah, I mean, that, and, those of us who have been through treatment, I don't want to say everybody, but, many people that I talk to definitely feel like we've aged. Inside you feel like you're 90 or something. And so, yeah, that's interesting. That's actually, you're able to see that on imaging. So our favorite friend or foe, inflammation, plays a huge part in this.
Yeah. It's interesting that you phrase it that way, because I think they've actually used that in some scientific articles that summarize inflammation in our body. And, often they'll put friend or foe ?
And it's both, right? I mean, a certain level of inflammation is actually helpful. It helps your body to heal. It signals to the rest of your body, like, okay, let's send in all of the things that we need to heal.
Right.
But, the levels of inflammation that we experience when going through treatment, whether it's surgery, radiation, chemotherapy, hormone therapy, targeted therapy, all of that can definitely contribute to this. Because I've seen it. I think the greatest population of patients that I've heard speak of this has been with breast cancer patients, but I've had other patients also talk about this.
Yeah. And I think because we do have a growing population of survivors of cancer. The breast cancer survivorship population is probably got more data going all the way back to the 1950s than any other type of cancer, to be perfectly honest. So I think this becomes a bigger issue because it's affecting more people.
For sure. And a really interesting thing is I remember reading that there is a pretty big percentage of at least breast cancer patients who complained of memory issues prior to being diagnosed. So they verbalized that, that was their baseline. And that's funny because, hello, that's me.
Mm-hmm. Mm-hmm. Well, yeah, I think there was a study a couple of years ago or so that came out and talked about memory issues before treatment. And I think it was breast and colorectal cancer in that particular study. And they showed that they had cognitive impairment prior to their treatment as well as afterwards. So that is interesting. Then does cancer itself become something that we should think about causing some of the problems that have to do with cognition? Is it the inflammatory state because cancers themselves create some inflammatory cells?
Right. Because a year prior, I had my cancer. I just, didn't know I had my cancer. So that is really interesting.
Right. So now when there's an association like this, when you see there's cognitive difficulties before the cancer is diagnosed, but we know the cancer was present, we have what's by definition an association, but we don't know. It's a chicken and an egg thing. We don't know what's causing what.
Yeah. And so, just knowing that, if somebody is complaining of memory issues or adult onset ADD, which I think I used to always say, then think inflammation. I mean, I wouldn't be like, think cancer, but definitely think like, maybe there's a lot of inflammation. Maybe there's a lot of stress. Stress plays a big part of it. There's another chicken and egg thing is like the sleep depression kind of cause, is it because sleep is impaired oftentimes during treatment as well as after treatment? There is, depression, anxiety, these sort of things also may contribute. I'm not going to say that they actually cause it, but they're definitely, contributors. And then lack of activity, being sedentary.
Sleep and exercise, I think, have the most data on them as far as cognitive function, directly affecting it nearly immediately.
The webinar mentioned cytokines and memory. And I thought that was really cool. And I was going to look at it this morning. I had found a study, but I can put up this little chart that I found, and it talked about the different cytokines, the different signaling
networks.
That are correlated to different parts of executive function.
Yeah. And cytokines are interesting because just like inflammation, you need the right amount at the right place for a short duration sometimes to create and consolidate memory and to learn something new sometimes. I mean, the more you study biology, the more you realize nothing is inherently good or inherently bad. It has to do with time, place, dose, duration. So the brain is one of the most complex organs in the body to understand, because we're talking about physical, but we're also talking about the transmission of basically electrical signals. So we get into physics pretty quick. So we're not going there today, but I'm just saying that inherently complex.
Another sort of, I would say, complex aspect of a possible cause would be a genetic link.
Yeah. So you're talking about some of the genes that are associated with cognitive function over time.
Mm-hmm. Yeah. I mean, the one that I mostly think of, I know in the webinar, I learned that there were 2 other potential genes that were related, but they did mention the ApoE gene, which was something that I have been doing a lot of reading about as well. And that's a gene that is linked to Alzheimer's.
Yeah. So you can inherit 1 or 2 of those genes, and that will raise the risk of Alzheimer's. And that is not disconnected from inflammation. So it raises your risk of Alzheimer's, and inflammation exacerbates that risk. In and of itself, it's a risk factor. And then you add inflammation to it, and you've got a recipe for speeding that up considerably. So that reminds me, there was a study, I think it was actually this year, that talked about machine learning and taking images of the brain with MRI and other high-tech brain imaging devices and using machine learning, seeing patterns of communication, what they called connectedness in the brain, and using that to predict who was going to have cognitive difficulties from treatment. So what they're trying to do is put this into the hopper and use this as one of the possible risks that one is taking with treatment, is to come out the other side with some cognitive difficulties. If that's the case, can we predict who that's going to be and put that in the pros and cons of getting that treatment? So this machine learning that looks at the images and parses out that information and says, these particular people will have more difficulty, and these people over here who have a better connectedness or a different pattern, whatever it is, won't have as much trouble. I thought that was cool.
That is cool. Another thing that they mentioned in the webinar that I thought was fascinating was that there's this whole like emotional aspect, becoming more emotional about things. Mm-hmm. And I do recall speaking with one of the surgical PAs at work and telling her everything that I was experiencing. And she was not a cancer survivor. You know, she had never been on any of these therapies. And she looked at me and goes, "Oh, honey, that's menopause." And I was like, whoa, that's crazy. Of course. Like, why didn't I think of that? But, you know, it's all of those kind of mood swings that, you know, 1 minute you're crying and you're, you know, this emotionally labile situation, you know, is going on. And so that's also probably why a lot of breast cancer patients, I mean, I've also heard this from patients with prostate cancer and, you know, from other people who treatment just shut down their hormones.
Yeah, it's amazing how the hormones influence emotions in particular, right? Yeah.
Emotions and memory. I mean, right? Isn't estrogen protective? Yeah. Once you lose estrogen, you find out how, again, friend or foe. It's your friend until it tries to kill you. But I guess maybe we should move on. Let's talk about, is there anything we can do to prevent it? Are there things that we can do to address it? Like, of course, there are things that we can do. We'll talk about that next.
Yeah. So when it comes to prevention and to treatment, the NCCN guidelines for patients mention some treatable causes. And I think you've already mentioned some of these: sleep and depression.
And the fatigue.
And the fatigue that can add to the fogginess. Some medications too.
And right, medications and pain for which people take, you know, these medications. So yeah, that would be the first step, is to find something that is treatable, you know, potentially treatable.
Right. And that's contributing to your brain fog.
Exactly.
Right. What's contributing to your particular scenario? Is it sleep? Is it more dietary? Is it fatigue adding to it? Is it stress? And if it is stress, can you either jettison that stress or maybe find other ways that we're going to talk about to deal with that?
Yeah. Finding other ways of coping. So the evidence that is out there is a bit of evidence about cognitive training. And so that would involve doing the, you know, apps and, you know, mind games, playing mind games, even doing things like, you know, putting reminders on your phone and all of those types of hints that I think many of us have sort of found on our own. Finding little tips and tricks to help you remember things that you need to do throughout the day is part of cognitive training. Meditation has been shown to be helpful. And again, something I learned with this presentation that I watched, and I'll put a link in to the presentation because it's pretty darn cool. They looked at meditation and classical music. And so they had one group of people doing this, I believe it was a 12-minute meditation that involved repeating words and using hand movements known as mudras. And then they had other people listen to classical music for that period of time. And then they checked over a period of time, they checked their cognitive function, and meditation showed improvement on, certain aspects of cognitive function, certain categories, and music showed improvement on other areas in some people. So it was this really cool study. And I thought that was awesome.
That is awesome.
So music therapy, listening to classical music. And what's cool is I do remember when I was doing pre-med, learning that listening to classical music while you study is supposed to help you with your memory. So I just thought that was kind of neat.
That's awesome. Yeah. And that reminds me of the studies that show that, learning new things in a dance class, because now you're using active memory and learning something, you're doing it in a social setting, and then you're moving your body, that's really good for cognition as well. So they've done that in some studies. And I thought that's a great way to combine a lot of non-drug therapies into one and make it fun.
Yes. And that was one thing before I ever went through treatment, I used to recommend to my patients something like Zumba, right? Because you're getting exercise. Zumba is cool because you kind of learn a movement and then you learn another movement. Like you slowly learn, you build on the choreography when doing Zumba. And so I found that to be helpful for myself prior to treatment in terms of remembering things, increasing that blood flow and, memorizing the steps. And learning a new instrument is the other thing that I used to recommend. So ukulele, I'm pointing to my ukulele across the room, teaching yourself an instrument, teaching yourself a new skill. There was a study that was done on looking at yoga and quality of life in, I believe, breast cancer patients. And what they found, surprisingly, was that it actually helped with cognition.
Interesting.
And I don't have the information offhand, but I do recall it wasn't like doing a lot of yoga. It was just like this short period of time. A week, of kind of dedicating a little bit of doing yoga. And I think Qigong has also been shown to be helpful. And part of me thinks, because I did Qigong in school, and part of me is thinking is it that choreography, right? Because in yoga, I always found it frustrating that they would kind of go through this flow of movements, go from one posture to another posture. And then they'd say, find your own flow. And I was like, I can't. What are you talking about? Find my own flow. I need you to show me. And I think doing that repeated movement with your body and then trying to remember what your body did, previously, I think that's huge.
Wait, so do you have a flow now?
Well, now I do my own yoga, so I've got my own flow.
That's my question.
I got my own flow.
Are you going with your own flow? That is the question.
I haven't taken a public yoga class in a long time, so.
So I want to say, we're talking about learning all these things and learning new skill sets or challenging your brain with cognitive training. And one, we have to remind everyone, because if you're old enough, what you learned in school was that your brain doesn't have the ability to create new synapses, and it does. It's called neural or neuroplasticity. And we now know the brain can create new synapses. And I want to just add to this, you have to also sleep well in addition to creating the new synapses and the new connectedness in the brain. Your sleep is when you consolidate that stuff.
It's your repair state. That's when your brain, that's when your body repairs itself.
Yeah. So sleep is essential. So there's two things that I want to mention going on when you sleep, because they're so essential to bringing your cognition back. One is you have a lymphatic system in the brain, and it's called glymphatics, starts with a G. Your glymphatics works like the lymph in your body. It's part of your immune system. And one of its roles is to clear out the brain. And we know that even those amyloid plaques in Alzheimer's disease, those are cleared when you're sleeping by the glymphatic system to an extent. So these protein aggregates, amyloid beta is the one people know about, maybe because it's talked about with Alzheimer's.
Right.
But there's other protein aggregates, and that has to all be cleared out. And the other piece that's happening while you sleep that's fascinating is called pruning, like a tree.
I don't know if I like that term.
No, it's so fascinating. You create these sprouting branches in your brain of neurons during the day because you're taking in all this information. And then when you sleep, they consolidate. And what that means is the non-essential neurons get trimmed off. What that does is it strengthens the remaining ones, just like when you prune a tree.
Oh, wow.
Yeah. So that's what memory consolidation is about.
So that leads me to say all of these things in terms of preventing this from happening. I don't know if it can actually be prevented, but we can reduce the risk by making sure that throughout treatment, we're addressing sleep. We're addressing stress. We're addressing depression. We're moving. I think the key to, and you know how I feel about the word prevention when it comes to cancer, but the key to reducing the risk of cognitive impairment from treatment is just get on top of it, while you're going through treatment, because it's going to help with so many other things too.
Yeah. And know that no matter where you're at, whether it's 2 months, 2 years, or 12 years out from treatment, there is still potential for new neural synapses to develop. Neural plasticity is ever present.
Yeah. Some of the other things I will share that I do for myself. Well, I think, working on this podcast definitely helps with my having to look things up as we prepare for each episode. I've been reteaching myself Spanish. I learned Spanish when I was a little kid and then quickly forgot it when I returned to the United States. And so I watch TV shows in Spanish with English subtitles, and I try not to look at the subtitles. And so, just by learning not really a new language, but relearning a language. I mentioned my ukulele. And then one thing I did was when I lived in Arizona is I took flamenco lessons. And, I have a slight dance background, and I have to say that's one of the hardest things I've ever done. I don't advise it if you have neuropathy because it's really difficult. But flamenco is unlike other dance that I've learned where it's a different, I can't remember how many beats it is. I think it's just, it was just such an unusual count. I mean, that was a real challenge because you're moving your feet, you're moving your head, and you're moving your hands. It's kind of like that rub your tummy and pat your head type of a thing.
Right.
But then bring in your feet.
Yeah.
And there's something for everyone,
We get so busy and life takes us away from what we used to do and what we might have enjoyed in our earlier years. So I often will sit there and help people reflect back or give them the assignment of saying, what really truly brought you joy? When you had time to do whatever you wanted, what did you do? And maybe revisiting some of that. I mean, did you play an instrument? Did you go out? Did you dance? What was your creative outlet?
Yeah. And then, those were conversations I had with patients too, especially because in a way it's a good distraction from everything that's going on. Finding something that brings you joy. I love that. We need to mention something that I can't believe, I think we forgot to mention in our cancer fatigue episode, which is hydration.
Oh,
making sure that you're hydrated. What's so funny is I was so tired when we were taping that.
Oh, you were fatigued and I was dehydrated, I'm sure.
Yeah, no, but I think, there were a couple of days where I wasn't drinking as much water as I typically do. And then I remembered we didn't even mention hydration during that episode. So I wanted to make sure that we did mention hydration is really important when it comes to memory. Diet is important as well.
Yeah, I guess we didn't mention that, but sure, the brain is substance. I mean, it's mostly made of fat. It's about 3 pounds total. There's also neurotransmitters, which are made from amino acids, which you get from protein. So you need healthy fats, healthy proteins, and then you need some carbohydrates. Your brain prefers to run on glucose. It really does. It's right. It's almost exclusively runs on glucose. It is capable of running on ketones as well. Yeah, the components, the brain structure, and its energy processes require a healthy diet. And that's back to the same diet we kind of always keep revisiting, which is a plant-based anti-inflammatory diet.
Right. In addition to diet, there are supplements that have been looked at. I don't believe that the NCCN handbook acknowledges this in any way, but there are certain supplements, like I said, that have been investigated that can help to support cognition.
Yeah. And we've talked a little bit about inflammation, or at least we've mentioned how inflammation can contribute. So top of the list is often things that quell inflammation, including in the brain.
One thing that I saw that was a recommendation was for certain prescriptions. But when I looked it up, and then also, from what they were saying in the webinar, there is no conclusive evidence that medications for, ADHD or medications for Alzheimer's, that those are actually helpful. So at this time, there is not evidence. I guess those are being used off label.
Okay.
But I thought that was interesting too. This is something that we can do to support our patients. And for me, myself, lifestyle modification.
Yeah.
Diet and lifestyle.
Mm-hmm.
But there were also supplements that might be helpful. And so let's talk about them.
Supplements are going to come up next.
So supplements, I mean, they're constantly being studied, these different products, in terms of memory, with Alzheimer's, and more recently looking at it for cancer-related cognitive impairment. Do you start these during treatment? Maybe. Do you do these after treatment? Maybe, so
Mm-hmm.
what's the evidence out there for these supplements?
So this is a growing topic in the research as far as what helps the brain, what helps with mild cognitive impairment. And that's brain fog from treatment, or it's just the aging brain as well. But in any case, there's decent evidence in some natural agents, or what are natural agents here in the United States, and might even be a prescriptive drug in Europe. And the first thing I'm thinking of when I say prescriptive drug in Europe, and it's a supplement here, it's citicoline. It's also called CDP choline, but citicoline is a molecule that probably has the best evidence.
I have a friend who has a traumatic brain injury, and I know that he's taking that, and it was recommended by his neurologist. So, I mean, if you think about it, I think of chemo brain as traumatic brain injury.
Yeah. And traumatic brain injury is definitely being researched more now that we know what happens with repeated brain injuries and how that leads to neurodegeneration. But there was a Cochrane review on citicoline, and I'm going to read their conclusion, because a Cochrane review, if you're looking at evidence-based medicine, this will influence how neurology is practiced if neurologists know about this review. So their conclusion was some evidence that CDP choline provides modest but consistent positive effect on memory and behavior in at least the short, medium term in elderly people with cognitive deficits associated with chronic cerebral disorders of the brain. So they have evidence for at least short, medium term in elderly people. Translation is there's not enough data on the long term. It doesn't mean it was disproven. But citicoline potentiates or improves that neural plasticity I was talking about. And another one, I guess right behind that, I would put some things that are anti-inflammatory. And top of the list might be curcumin and boswellia. Those two are top of mind for me when it comes to brain inflammation.
And I think omega-3s, food and as a supplement. But I love when I used to sit in with the team dietitian and we would talk to patients about foods with omega-3s. We would talk about walnuts as being a source and how they look like a little brain. They do. They have little hemispheres and everything. So, it doesn't have to be the big honking fish pills. So basically anything, in your diet that reduces inflammation, like a diet rich in whole grains, fruits, vegetables. I know this is the supplement part, but you got to throw in the diet, right?
It's true. Yeah. Anything and everything that can be anti-inflammatory from a lifestyle and diet perspective is a good thing.
Just think of food as a supplement, right? I mean, it's basically these individual nutrients all packaged up into something delicious.
It is true. We can eat a pro-inflammatory or an anti-inflammatory diet. And a pro-inflammatory diet is the standard Western diet, high in processed food and sugar and all that stuff. And anti-inflammatory diet is whole foods.
What about ginkgo, right? Ginkgo is one of those things. Oh, I got to tell my ginkgo joke. I brought it up just so I could tell my ginkgo joke. And it's not my joke. It's an Ellen DeGeneres joke. But,
right.
You don't need ginkgo biloba if you remembered to take it.
But
I guess I didn't tell it right. I'm not very good at telling jokes. Anyways, what about ginkgo?
Yeah, ginkgo has been traditionally used. I think it has to do with the extraction process and whether it's extracted properly and has the right components, whether it has been shown to work or not for memory and recall.
It hasn't been investigated for the cancer related.
I have not seen it. I
I
haven't
haven't
seen.
either. And
Mm-mm.
I would have thought that there would have been some stuff, but it just popped up in my brain. So I thought I would ask.
Run with it. So, in addition to ginkgo, which has been traditionally used for memory, there are other traditional plants like bacopa and gotukola.
Oh, for sure. Yes. Ayurvedic herbs. Yeah.
I do include those in my formulas for people when we're trying to support brain health and recover cognition and improve neuroplasticity. Gotukola is also used for connective tissue in general, so it's good for the brain and it's good for healing.
I think that it's also known as the longevity herb. So, that's not a bad thing. I do believe that there are potentially interactions with medications and like all of the supplements that we are mentioning. Do not start taking these on your own because we are not your doctor. We don't know what's going on with you.
Yes. And there's a couple other natural agents that I use that you have to take in larger doses. So I use them selectively when people are capable of taking the proper dose. These are not ones that I think people should take in a small amount if they want to get an actual effect from them. One of them that comes to mind is one of the mushrooms, lion's mane.
Right. Oh, I actually see people cooking with it too. I think that's pretty cool.
Yeah, it's delicious.
But yeah, that was one supplement that I never saw any huge results with, but I think it was just because you have to take a lot.
Yeah. I think that some people may not be taking enough of it, and the proper extraction, as far as mushrooms go, in my opinion, proper extraction means you're doing it the way that it's been traditionally done. Mostly in Asian countries, we have the information on how mushrooms were taken for medicine. And they used what's called the fruiting body. The fruiting body is what we see when we call it a mushroom. When we look at it, we buy it in a store. We're buying the fruiting body underneath the ground or in the substrate wherever they grew it, if they cultivated it, is what's called the mycelium. And that's equivalent to the roots of a tree, right? So this mycelia is the underground aspect. But you want the fruiting body to be hot water extracted. So normally in traditional medicine, you would take that mushroom, you'd cut it, you would dry it maybe if you want to preserve it, but then you would ultimately boil it.
So you're making a tea, like, or a decoction.
Or a soup, yeah.
Oh, ooh. Soup.
So in any case, mushrooms have a cell wall that you and I can't break through, right? So we have to break it open with heat, get the goodies inside into the solution. And some companies go through all that trouble of growing it, cutting it, extracting it in hot water, taking that hot water and dehydrating it down into a powder. Not surprisingly, when it's done properly, they're rather expensive. And you have to take them in a pretty good amount, like 2 to 3 grams a day. So we're talking gram doses of these powders. That's a lot different than taking, 250 or 500 milligrams of citicoline, which is 1 or 2 capsules a day.
Right.
So I put the lion's mane down on my list just because it's not practical for a lot of people, not because I don't think it works. And the other one that you take in higher doses to get some results is acetyl L-carnitine. The evidence for acetyl L-carnitine is not in chemo brain in general, but for elderly brains, for the aging brain. But it is also 2 grams a day. And, when you have to take 2 grams a day, it's either a lot of capsules or you have to resort to a powder. And that powder does not taste great.
No, it smells like vinegar. I don't mind the taste, but it smells I open up the container, it would smell like vinegar. And then the taste is very tart.
Tart bitter, right? Like it makes me make a face.
Yes, it does. It does. And there are some contraindications for taking acetyl L-carnitine during some treatments. And so that's one to use caution. If you're in active treatment, just make sure there's no interaction. So, yeah, I think that's a pretty good summary. Did we leave anything off?
Maybe just the one, you mentioned earlier about how maybe there was a little bit of like attention deficit aspect for you where it's hard to filter out inputs.
Oh, focus. Oh, theanine. Oh, and I love my theanine. I love it. It's like my best friend. My dog takes a supplement with theanine. Oh my gosh, she does.
It sounds like you put theanine in your salt shaker. Just put theanine on everything.
I should put it in my water filter. I love theanine. Yes. And my experience using theanine was before I worked at the cancer center, was, using it in children with attention deficit disorder. So for sure. Oh yeah, I love it.
Yeah. And it's a really nice substance because you can get away with a very small amount, 200 to 400 milligrams, a capsule or two. And even taking it earlier in the day has been shown to be helpful to help people sleep that night. So not only does it help you with focus during the day, and specifically with filtering out those distractions, being able to watch one thing and not have that little effect where it's like squirrel,
Corgi.
So there's that. And it also helps the brain relax.
Well, we mentioned it before, and you talked about that it creates the same waves as if you're in a meditative state.
Exactly. Yeah.
I love that. Meditation and a pill.
Yeah.
It's so much easier.
I know, really. I know that's as close as we get to, putting a lifestyle into a pill.
And then a fun fact with theanine is for people who take in caffeine, there are studies showing that the caffeine plus the theanine, because theanine is derived from green tea, but itself, there is no caffeine in it. Mm-hmm. But if you take theanine and you have a cup of coffee or a cup of green tea, maybe some matcha that has a higher amount of caffeine, that actually has shown to help with focus. We did that in school to try when we studied.
Yeah. And the last thing I want to mention is essential oils. A lot of essential oils can be used in inhalation capacity. So you can get a diffuser and use things like frankincense, even clove, the very aspect that gives a lot of our spices that we use in the kitchen their distinctive scent are molecules that will lower inflammation. And when you inhale them through your nose, that is a direct link to the brain. I mean, you're very close to the brain, and it's not surprising that you can take what goes into the nose and it has a direct access to the brain. It goes immediately through the mucous membranes and into your system very quickly. When people cannot or don't want to take pills or powders or whatever, this is an easy thing you can do, is add essential oils to a diffuser and have that handy nearby.
And, again, that was something that we used to do during studying, was to have these essential oils. And then before an exam, just kind of waft the bottle to try to remember. Yep. And in my office, I had a diffuser, and I had rosemary and, my own little blend of essential oils. So maybe that was helping me ultimately. Who knows? Mm-hmm. Who knows? It just felt good, and it was relaxing when I stepped into my office. And so anything to reduce stress.
Yeah, there's very little downside risk. I mean, have a nice clean diffuser and use the purest essential oils, and then there's very little risk.
Yeah, and so we've covered the possible causes and things that can be done as risk reduction or to actually address the chemo fog. The words escaped me. And then supplements that might be helpful as well. I don't know if I'm the best ad for this.
You're doing great.
No, it's because we're always doing it like right before lunch. And so
I know. This is when we fade.
We're
right on time.
Yay. I think this brings us to the song. You know what? I didn't forward you the song.
No.
It's actually kind of awesome.
Okay.
I played it for my husband, and he was like really down with it. It is a song called Brain Cloudy Blues, and it's by Merle Haggard.
Oh, God, I wish we could do a little excerpt right now.
I know, and we can't, because even though these are our unofficial theme songs, we are not paying any royalties for them. So head on over to Spotify, and you can hear this on our unofficial theme song Spotify playlist, or mixtape, as we call it.
And you added that to our homepage, too. So if people go to our website, they can see it on the bottom of the homepage.
Oh, did I add it there too?
Mm-hmm.
Oh, I don't remember. I will be adding it if I didn't.
You did. You did.
Okay. And then, what's cool is that somebody on Instagram sent me 2 more songs for Survivorship. So I'm going to keep adding things. If you've got
cool.
songs that you think represent Survivorship, we're going to keep this going.
Oh, nice. So we have 2. We have our unofficial theme songs for each pod.
Right. For each series. Yeah. Each series of episodes, which is a pod.
And then we'll have an ongoing. So far it's 10 songs.
No, it's more than that because I just added more. And
all right.
The
Survivorship album mixtape.
It's a mixtape.
I love a mixtape.
I don't know if some people don't get mixtape. Please Google it
well, you have to be over a certain age.
I know, but it's such an awesome thing. I even make mix CDs and call them mixtapes.
I think it's fitting.
Okay. And you know what? I completely flailed on the moment of woo. I'm sorry. I came up with an idea and I didn't do my research behind it. So I know that you have a moment of woo.
Yes, because I held my tongue when you talked about that walnut looking like a brain thing.
Oh.
That's the moment of woo we have right now. Because that is one, that sounds woo-woo in and of itself.
It does.
And it is.
It was a way to have patients remember. So,
but it's an official woo-woo thing called the Doctrine of Signatures.
Yes, this is something that we learn in herbs class.
Yeah. So when a plant looks like the organ that it is indicated for.
That's the Doctrine of Signatures right there. Yeah. It's like the color or the shape. Yeah.
Mm-hmm. So classic is walnut because a raw walnut looks so much like a brain and it does. The walnuts are good for the brain health. And then ginkgo comes to mind. Looks like 2 lobes of a brain. Mm-hmm. It's a 2-lobed leaf, which is pretty unusual. And then the other one that comes to mind, and we have lots of it here in the Northwest, is the hawthorn tree.
Sure. Well, and the hawthorn berries, right? They're red.
Mm-hmm. And they're for the cardiovascular system.
Mm-hmm.
So the berries are red, usually.
When are they not? Oh.
No, we have a garden here, a botanical garden that has different hybrids that they go to yellow to red. But the one that we classically use for medicine is a red hawthorn. And the trunk itself looks like a vascular bundle.
So that's an excellent moment of woo.
It's really a good moment of woo because it's fun to play around with the idea of it.
Right. So the next time you look at your food, you're going to see it in a whole different way.
That's right.
Maybe you should do more moments of woo. I'll save the one that I was going to do for this one. I'll find a place to put it in another pod because it was a good one. But for now, thanks for listening. Hope you learned something. If you can't remember what we talked about, we're going to have show notes and we're going to have links to various topics that were mentioned in the show. And we've been putting up transcripts on our website. And so you can go back and see what we had to say about this subject of chemo brain.
Yeah. So like us, subscribe, check out our website. We're going to start up a newsletter in the new year sometime. Keep in touch.
Yeah. If you are interested in getting notices on our newsletter, which will probably be monthly, sign up on the website. You could sign up through the link tree. And then I also added to our Instagram a link where you can email us directly if you want to give us a shout out or ask us questions. Do not ask us questions about your medical health because we're not your doctor.
I love Linktree. I think Linktree is cool.
It is cool.
Because then you can, go wherever you go. Like you look at Linktree and you're like, oh, that's a place I go, whatever that is. iHeartRadio or Spotify or whatever.
Or our website.
Hint, hint.
Hint, hint. On that note, I'm Dr. Leah Sherman.
And I'm Dr. Tina Kaczor.
And this is the Cancer Pod.
Until next time.
Thanks for listening to the Cancer Pod. Remember to subscribe, review, and rate us wherever you get your podcasts. Follow us on social media for updates. And as always, this is not medical advice. These are our opinions. Talk to your doctor before changing anything related to your treatment plan. The Cancer Pod is hosted by me, Dr. Leah Sherman, and by Dr. Tina Kaczor. Music is by Kevin MacLeod. See you next time.